Okay, in this video we're going to show you how to very quickly and easily screen for diabetes. Diabetes or sugar disease is very common in adults, particularly late development or adult onset diabetes called type 2. It's occurring in an increasing proportion of the population. We think probably as a consequence of obesity, but there is a family history quite often in these cases, so it is a familial in its tendency. It's very easy to screen for diabetes. The commonest parameter that you can test for is the presence of sugar or glucose in urine. Now, in healthy adults that don't have diabetes, even after eating a lot of sugar, they should not be excreting sugar in the urine. So a very quick and easy way to screen for the development of diabetes, which usually doesn't give rise to any symptoms for a few years, is to just dip the urine for the presence of sugar. Now, one of the products that does this is the Mission Glucose Test Strip. This is a single parameter test strip. By that we mean it's just got one pad on each test strip. These come in plastic vials as shown here of 25 test strips, and the test strips, when they come out of the vial, should match the completely negative colour in terms of that turquoise colour. So to perform a test, it's very easy. You just collect a urine sample, and we have one here, and it is a matter of simply dipping the test strip into the urine sample just for a couple of seconds, just knocking off any excess urine, and then you're waiting for the pad to react with any sugar that's present in the urine sample. And in a negative result, after 2 minutes, the pad should not have changed colour at all and should still match the clear negative colour on that first example on the side of the pot. Now, if this sample contains sugar, as would be expected in somebody with diabetes, then the degree of sugar in the urine will cause the pad to change to one of these colours, and the darker it gets towards the brown colour at 2 minutes indicates higher level of sugar in the urine. So the results are what we call semi-quantitative. By matching the colour on the pad to the examples on the side of the test vial, you can get a semi-quantitative, or a range in which the glucose in the sugar is measured at, and that gives you an indication of how severe the diabetes is on that occasion. Now, obviously urine sugar will vary throughout the day, so the best time to screen for diabetes is usually an hour to 2 hours after a large meal or a sugary meal. But in well-developed, established diabetes, you will most likely find some degree of sugar in the urine if they're not under treatment any time you test during the day. So this is a very easy, quick and low-cost way of screening. A pack of these Mission URS 1Gs or glucose test strips contains 25 tests, allowing you to repeat test over a period of time or to test all members of the family. Now, once the test vial is open and the seal broken, the test strips should ideally be used within 3 months. Now, that's the manufacturer's recommendation. The risk with all URS products, that's urinary reagent test strip products, is once the seal is broken, these test strips will start absorbing moisture in the atmosphere. And once that happens, you will see that the pad starts to change colour, it deteriorates with time, and if they don't come out of the test pot matching that first example of a clear negative test, then it's time to replace the test strips with some fresh ones.